Hi, I'm Dr. Leana Wen, and I want to thank the Addiction Policy Forum for the incredible honor and for your work to help patients and families across the country and translate the science around addiction. When I was first appointed the Health Commissioner in Baltimore in late 2014, we were facing an escalation of the opioid epidemic and a rising number of opioid-related overdoses. The number of people dying from overdose was rising at an alarming rate. If this many people were dying from any other disease, we would have long ago declared it to be a public health emergency. Unfortunately, there is so much stigma surrounding addiction and so much misunderstanding about the nature of addiction that we as a society have not understood it to be the disease that it is. In Baltimore, we worked to address this public health crisis by taking on a three-pillar approach. The first was getting naloxone into every single person's hands. We got legislation changed so that I issued a blanket prescription for naloxone for every single one of our 620,000 residents in the city. We conducted over 30,000 trainings, and within 3 years, everyday residents saved over 3,000 lives of fellow family members, community members, and friends. The second was to increase treatment. A previous report found that only 1 in 10 people with the disease of addiction can access the treatment that they need, which we would never find acceptable for any other disease. We worked in Baltimore with our local hospitals to increase treatment, instituting what we call the levels of care for treatment for addiction and mental health in every acute care hospital. We also started a stabilization center to provide specialized resources for individuals needing addiction and mental health support that was a diversion from the emergency department, and we actually envisioned the stabilization center to be a first of its kind ER for addiction and mental health. The third was to increase education and reduce the stigma surrounding addiction. To accomplish this goal, we started a citywide education campaign called Don't Die. This campaign continues to operate and provides resources and education to help people living with substance use disorders and their families, and includes things like a 24/7 phone hotline for anyone to call for resources and connections to treatment. In addition, we also launched the Law Enforcement Assisted Diversion Program, modeled after the program first started in Seattle, working closely with our police department and city prosecutors. This program allows individuals arrested for a low-level drug offense the opportunity to enter treatment instead of prosecution. This is another vital component to help change the conversation so that addiction is treated with the same compassion and dignity as we treat other chronic illnesses. I am so proud of the work that the Baltimore City Health Department and all our partners, including Behavioral Health System Baltimore, have done to save lives and change the narrative around addiction. I am deeply grateful to the Addiction Policy Forum for honoring us with the Pillar of Excellence tonight, and also for giving me the opportunity to speak with all of you today. The Addiction Policy Forum understands that addiction can be overwhelming for those struggling and for their families. And by the work that you do, by hosting events such as the National Leadership Conference, providing vital resources and information that can be made widely available to help address addiction as any other major health challenge. Thank you again for this award, and I look forward to seeing the amazing work that Addiction Policy Forum will accomplish in the months and years to come.